So I thought, um, I was thinking about the idea of morality in medicine, and then I thought about, I should apply this to the Apex course because I want people to understand why it is that I have the position that I have about therapy. And so the slide, it was medical morality, and so this is the position or the statement that I said. I said, um, it is my goal to treat the problem as directly as possible with the least number of sessions at the lowest cost to the patient to provide the optimal result in the shortest amount of time, and also to educate and empower the patient. Think how, like, these are all things that are beneficial. I want people to get as
Mm.
better as fast as they can with as little cost to themselves as possible, doing as little harm to them as possible. And I want to give them education, and I want them to understand that really, if I give you this information and teach you how to do it, you don't need me, you can do it yourself, right? um, and it's kind of like this. I joke about, I'm teaching people. I'm trying to put myself out of business. I'm teaching people how to do it themselves. But
Mm.
I think that that's the right thing to do, right? And people, it comes back to what I said before: knowledge is power. And I think my goal is to educate people, and I'm trying to educate as many people as I can. And part of that, and one aspect of the education is educating people and teaching them that they don't really, for most things, unless it's traumatic, the bone is sticking out through the skin or the ligaments are all torn or whatever. For most things, they don't really need me or a therapist or a chiropractor. They need a little bit of education, a little bit of not common sense, and some guidance. And here, let me give it to you, right?
I love that, and I love how that you're actually giving back. You're not just sort of saying, "No, you need surgery, then you need to come to me every for the next 7, 8 years." You're actually
Yes.
just going, "This is what the evidence shows." Do you think that's what makes you such a good surgeon? That that you learn from failure. So if anything goes bad, you kind of go away and see how you can fix it. You're watching these videos, so you're learning how people have messed up or how the surgery's gone wrong, and then you're using that to kind of like, do because I'm not a big fan of like box breathing to deal with fear and anxiety at the time of that. But do you find that you're actually so well prepared that you've read over and you've practiced this and that you're using the experience to not feel the fear to overcome that anxiety?
So, well, first I got to preface it by saying I don't know if I'm a good surgeon. I hope that I'm a good surgeon. I would like to be
I
a
would
good
say
surgeon.
so. That's
But I know that one of the areas around which I feel very confident is that like, I'm a technician. I use my hands, and I feel very confident about my ability to use my hands. But I often say to students, or to people when they ask, um, if they say to me, "Well, what's your favorite case? What's your favorite kind of surgery to do?" Like, I'm primarily trained as a sports guy, but I do all kinds of orthopedic surgeries, and some of my favorite cases have nothing to do with sports.